Hi, my name is Aaliyah Parker, and today I'm going to be doing my cardiothoracic assessment. Can you please state your name and date of birth?
Tony Parker, T1272.
And is it okay if I perform an assessment on you?
Yes.
All right. So, first of all, I'm going to be noting his the anterior, posterior, and lateral wall. And I'm going to be looking for any lesions or deformities. I'm also going to be looking to see the shape of his chest and ask him to stand up and bend over, where I'll be looking at the curve of his spine, looking for alignment. Good, go ahead and sit down. While he's sitting here, I'm going to be looking and checking for respiratory rate and rhythm, any use of accessory muscles or any retractions. And then I'm going to be palpating, feeling for any crepitus that could indicate some kind of pleural rub. And then I'm going to be checking for symmetry by placing my hands at the 10th intercostal space and my thumbs at the left and the right of the xiphoid process, and ask him to take a deep breath in, noting symmetry or any asymmetry that could indicate a collapsed lung. Next, I'm going to move to percussion and auscultation. Going to this side. Starting at the 2nd intercostal space. Good. Checking for resonance is what we should hear. You can lift this arm up. And that's what I'm noting. You put that arm down. Please lift up your other arm. And I'm going to have you turn around so I can do your back. And while he is turned around, I'm going to go ahead and listen in those same areas using the large portion of my stethoscope. All right, and then you can lift this arm up, please. I'm going to listen in those same areas. Thank you. Put that arm down. Lift the other arm up, please. Thank you. Put that arm down. And then if you can turn around for me, please. Just breathe normal. Okay, so while he's in this position, my patient would probably have his shirt off, but I would be inspecting and assessing his precordium area, looking for any abnormalities, deformities, or any lesions. And I will go ahead and identify his aortic point, which is his 2nd intercostal to the right of the sternum. His pulmonic point, which is the 2nd intercostal space to the left of the sternum. His Erb's point is at the 3rd intercostal to the left of the sternum. His tricuspid point would be at the 4th intercostal space to the left of the sternum. And his 5th intercostal space would be at the 5th, or his his mitral point would be at the 5th intercostal space, and that would be at his midclavicular line. And I will go ahead and listen to those now that I've identified them with the bell of my stethoscope. And while he is sitting upright, I am going to have him just slightly lean forward, and I'm going to listen to the apex of the heart, listening for any murmurs. Good. Okay, now I'm going to have my patient lay on his back, and we will attempt to move the camera in an angle so that we can visualize what we're doing. Okay. No, that's not. Okay, well, we're going to just pull this closer so that we can see. Okay. So I would be, while he's laying on his back, I would be looking at the precordium area, and I would also be looking at his carotids and palpating them one at a time, checking for any distension, and I'm going to listen for any fruits or thrills. Very good. And now I'm going to listen to his heart sounds, and I am going to start at the 2nd intercostal space and make my way around the precordium with the bell of my stethoscope. I'm listening for any adventitious sounds or any murmurs. And I'm going to ask you, Mr. Parker, to lay on your side so I can listen for that angle as well. Thank you. Very good. If you can go ahead and lay back on your back for me. And then I'm going to move the camera slightly for a better angle. So while he's laying flat on his back, I'm going to identify some pulses. I'm going to be checking his brachial bilaterally, amplitude of +2. And then his radial, kind of show them. He would have his arms at his side, but his radial, which are +2. I'm going to turn the camera a little bit more and ask the patient to bend his knees up, please, and keep them right there for me. I'll be checking his popliteal pulses, which are a +2, his post-tibial pulses, which are a +2, and his dorsalis pedis, which are a +2. And that concludes my cardiothoracic assessment.